You are responding to a 70-year-old woman complaining of chest pain.
Okay, I'm gonna go ahead and put on my PPE. I'm gonna go ahead and do my scene size up. Is the scene safe?
Scene is safe.
And is this my only patient?
Only patient.
Okay, and she's complaining of chest pain, correct?
Yes.
Okay, so patient is currently complaining about chest pain. I'm gonna go ahead and call for additional ALS, and I wouldn't consider C-spine just due to the nature of her complaint, which is chest pain. I'm gonna go ahead and introduce myself. Hi, ma'am. My name's Carlos Cuevas. I'm an EMT. I'm here to help you out. So right away, I noticed that my patient is responding. She's alert. And right off the back, I'm gonna go ahead and see her airway, her breathing, and circulation. I'm gonna go ahead and check her pulse. Okay, so the pulse is there. It's just a little weak. I'm gonna go ahead and check her ventilation. I'm gonna check her ventilation, and I'm also gonna start her on some oxygen therapy. So let me go ahead and put that on. Okay, patient is currently on oxygen, and I'm gonna go ahead and let her and know that this patient is currently on 15 liters of oxygen. Right away, I noticed that her skin is a little pink and yellow, a little bit sweaty. And from there, we're gonna go ahead and make her a priority patient. She's not in any major trauma. I don't see any kind of bleeding. While we're en route to the hospital, I'm gonna do some OPQRST questions. Okay, ma'am, so can you please tell me how long did you start feeling this chest pain?
For about an hour.
Okay, you started about an hour ago. Can you describe your pain on a scale from 1 to 10, 1 being okay and 10 being the worst pain of your life?
A 7.
A 7, okay. Has your chest pain moved anywhere around your body today?
No.
Okay. Can you describe your severity of this specific chest pain as opposed to other chest pains you've had in the past?
About an 8.
About an 8. Okay. So it's been about an hour and a half since her initial chest pain complaint. I'm gonna go ahead and recheck her circulation. Circulation is still there, it's still strong. I want to make sure everything's going smoothly. I'm gonna go ahead and do a little bit more questions regarding her past medical history. We know her associated symptoms are a little yellow in the skin and a little pink. Okay, so I'm going to go ahead and ask her, do you have any allergies?
No allergies.
Do you have any medications?
No medication.
No medications. Okay. When was the last time you ate something today?
About 6 hours ago.
Okay. Can you tell me what events led up to this specific event?
I went to the bathroom and I came back to my seat to watch Netflix.
Okay, so I'm gonna go ahead and also take her lungs. I'm gonna start off with the left upper quadrant, right here. Okay, and I'm gonna go ahead and check the other one. Okay, so I already went ahead and checked her pulses, her lung sounds, and I'm gonna make sure that she's properly ventilated. I'm gonna check her pulse again to make sure everything's going okay. Patient's pulse is still present, everything's still going smooth. I'm gonna go ahead and do her, let her know that her BPM right now is at 90, and I'm also gonna check her blood pressure. This is gonna be her blood pressure cuff, and I'm gonna go ahead and see her blood pressure. So I'm going to attach this to her left arm. Okay, the blood pressure is a little high. It's at 160 over 100. We're still en route to the hospital. While we're en route to the hospital, I'm going to, make sure that she's still breathing. She's breathing about 20 ventilations per minute. My initial general impression is that she has some chest pain and a little bit of yellow skin, looking a little clammy. The only impressions we've done is she's currently on oxygen therapy, and we're gonna go ahead and make sure she gets to the hospital and everything's okay.